Dr. Steenblock, I know that this is good for the eyes. I mean, it's obvious from what we have here that you can really help macular degeneration, but I've got a lot of friends with a lot of problems. At my age, that happens. What else can this be used for?
It's an amazing thing because stem cells, and these are your own stem cells,
Right.
they're used to heal any and all parts of your body. Just think about it. They're used to help heal the heart, the lung, the adrenal, the kidneys, the liver, the muscles, the bones, the joints, pretty much the skin, pretty much any place that you have ever an injury. Bone marrow stem cells come out of your bone marrow and circulate to that area of injury and go to that area of injury and help fix it. So what we do is we take a whole bunch of stem cells, like 2.5 billion stem cells, and we put those into your bloodstream all at once. And if you have any injury anywhere, those stem cells go there and start to fix it, you see. And so the question is really more like, what can't it be used for? And for example, can it help heal a fractured bone? Yes, it helps heal a fractured bone. Now, will it set the bone and put the bones back in place? No, it will not put the bones back into place. Okay? If you have a head injury and the scalp is flat off of your head, it doesn't reach up and pull the scalp back onto your head. It doesn't do mechanical things. Like I had a patient just now asking me about her scoliosis of her spine. She says she's got this humongous curvature of her spine and osteoarthritis, osteoporosis, and is it going to correct all of that? One treatment.
Oh, okay.
A little bit overly optimistic about what stem cells can do. You know, you have to have there's got to be some reason and method of how it works. And in osteoarthritis, it works because of the fact that these stem cells, there are what are called mesenchymal stem cells in the bone marrow. And these are programmed to take care of muscle, skin, bone, connective tissue. And so they go to those areas that are damaged of that type, and they really like to fix that kind of tissue. Arthritis is an injury of bones. And so anytime and anywhere you have bones that are injured, as in arthritis, these mesenchymal stem cells, when we flood the system with them, they'll go to those areas of your joints, your spine, your shoulders, your elbows, your knees, your hips, and help fix it. Now, does it fix it and permanently cure it? No. But what it does, number one, within only a few days, in most cases, you see a tremendous reduction of pain.
Yep.
And that is amazing.
With my hands, because I was interested in the eyes. But it's neat knowing that it's going over the whole body and working, and just looking for places to go to work.
That's exactly right. So you are already attesting that. I didn't realize that was happening with your hands. So you have arthritis of the fingers?
Well, it's just messed up from being a sculptor. Straining it more than it should have.
Yeah. Well, this is very common. And so I would say probably 80% of the patients that have significant bone pain from arthritis are helped significantly.
Okay.
Which, instead of taking ibuprofen and all the drugs that you know, or a lot of people can't take those drugs.
Yeah.
So this is a really attractive alternative because you're actually helping fix the tissues. And now, fix in terms of repairing and curing and having it all disappear and being like normal and new again? No, that's not what we're doing. We're shutting down inflammatory processes that are going on in these joints.
Okay.
And so it's a biochemical process of decreasing and eliminating inflammation. This kind of process can last, in my experience, up about 2 years after one treatment. That's in my experience. Now, there may be in other cases it may last a lot longer or not. This is still a new field, and so we've got a lot to learn and discover. Other things that I've seen help, I've had patients that have had acute heart attacks and who have within a week or two of having had the heart attack, we've given them the bone marrow stem cells, and we've been able to see that their heart heals much better. They're able to not develop congestive heart failure. And so that's an important area that is going to really, I think, take, once everybody, all the doctors out there start to know about the technique and use it, I think we're going to see that becoming mainstream medicine. This is mainstream medicine, they just haven't discovered it. And as soon as the doctors discover it and understand how to do it, then virtually everybody will be doing it.
A friend of mine described this as the medicine of the future.
It is.
And I said, you're right.
Absolutely. Personalized regenerative medicine is my phrase for it.
Yeah.
And that's what now I'm specializing in. Personalized regenerative medicine. Taking tissues from you and using those tissues to fix you.
Yeah.
So we're not using fancy, schmancy, expensive, side effect laden chemical drugs. We're using just your own material out of your own body. We're not adding anything to it. We're just taking this and putting it there.
I like that.
That's about as simple and safe as you could possibly get.
People want hope.
I'm sure glad that you were an early participant.
Me too.
And I'm especially glad to see the excellent results that you had. And you might want to come back and do another one of these days, because we're already seeing good results, and the more of these that you have, the more of these age-related diseases go away.
Yeah.
You'll see, if you look in the mirror, you'll see your skin actually getting younger looking and better looking, and you get healthier and healthier
Yeah.
the more of these types of treatments that you do.
Okay.
Okay? Well, thank you so much.